we've had here are cases where the man is not sure of what has happened.
Not sure.
Yes, usually arising from, say, a social gathering, a party of sorts, and you know, they find themselves in a compromising position the next day, and
wow.
they wonder whether or not something has happened to them.
Recently, we've seen a lot of stories coming out about men getting raped, and a lot of people surprisingly didn't know this happened in Jamaica. About how many men do you see coming into the emergency care?
We haven't seen men. We know that it's reported. The CISOCA, that is the Center for the Investigation of Sexual Assault and Abuse, they would see cases of male, well, we can't call it rape, bug rape, because that's the legal term in Jamaica. But we know it happens, and we have cases around Jamaica where we know it happens, but we don't get a lot of it here. We tend to get more child cases of buggery than adult cases. And again, perhaps because there are probably other factors, men may not wish to report it as well. They too have fear, you know, they probably can't, if they don't want to admit it has happened. Absolutely. So it depends on how bad it is. You know, clearly if they have a lot of injuries, what we may get sometimes, we've had here, are cases where the man is not sure of what has happened.
Not sure.
Yes, usually arising from, say, a social gathering, a party of sorts, and you know, they find themselves in a compromising position the next day, and they wonder whether or not something has happened to them. So we've had cases like that, and perhaps only one other case I can think of where it came close, but it wasn't a situation where it was definitely that this thing happened to me, but I think this thing could have happened to me, right? They require a lot of supportive care from their families and friends, but really they need a structured approach to help them through this process, and it should be done by a trained professional. You know, we can all give advice, but we can't always do it in a proper way. So I wouldn't take on the task of counseling someone. I would send him to a trained professional to do that. And it can be had at the Victim Support Unit or the Women's Center, for example. They do have services like that. So they offer good support. So that's really how you get over, well, or you deal with it. I don't know if you get over it, but you can learn to deal with it, yes.
In situations where you see someone's behavior changing and you think that they might have been raped, how do you approach them about it?
Very tactfully. Yes, because you will agree that persons may not wish to divulge that information for a number of reasons, even from their best, you know, to their best friends. Some people keep it from their family. But if you suspect, I think the best ways to do is to just kind of a general question: are you okay? I've noticed, you know, that you haven't been yourself lately. Is there something you'd like to talk about? Rather than ask, you know, well, you look like you were raped. Not that you can tell, but you want to have, and leave it open. Leave the discussion open. Leave it so that they can come to you and say, well, okay, I'm here for you, kind of thing. But because there's nothing that I can say specifically that you are going to look like, you know, people react differently to trauma. So some persons become very quiet, some become overtly aggressive, and they come in here and you know, some deal with it as if it didn't happen to them, you know, so they have a lot of posturing, and it's like, you know, whatever kind of thing is, yes, so I was walking, yes, I was raped.
Like it never happened.
Like it never happened, because they're trying to deal with it, and you have to be careful that you don't judge them, right? They're trying to, and that's how they deal with something that has happened that is very traumatic. So everybody's different. So if you suspect a colleague or a friend, then the thing to do is just let them know that you're there.
What about in cases where, say, a woman gets raped and she builds up the courage to tell a family member. And it's almost like they treat it like it didn't happen. So, for example, she told her mother that a family friend had raped her, and she's pretending, oh, it didn't happen, oh, you probably wanted it, or in a situation like that.
Okay. Those situations are extremely difficult. And unfortunately, we do have them from reports. People will come in here who perhaps didn't report it at the time, but they come for another issue. And it's during the process you realize that, something happened to them 3 months before. And when you talk to them, you get some of those reasons. They were told to leave it alone, and so on. Now, if they're adults, then the most you could do at this point in time is to offer them counseling. Make sure they get the proper counseling. If they're children, then you're bound to report it, right? If it's a child under the age of 18, you're bound to report that case. But outside of that, you really have to just be a support and let them know that it is not their fault. That is something that they need to perhaps talk about, or even report it. One of the things that we do here is we do encourage women to report cases, because as an adult, if they come here, they have, I guess, the right to say, look, I don't want the police involved, I don't want to report it, just treat me, do what you have to do, and let me go home. But we do ask that they report it nonetheless, because if they don't report it to the police, what happens is that we don't have the opportunity to collect the evidence at the time, because we can't store it. If I collect evidence, I have to give it to the police. But if there's no police, I can't collect the evidence. And what would happen, in a state, you feel you just want to get this thing over with, but maybe 3-4 weeks or even days down the line, you say, I really should report it. Or somebody convinces you to report it. Okay. But then now you don't have the evidence. Okay? But in a situation where family members discourage you, that is hard to deal with. And yes, we do get cases where a person says it's their fault. And it's not just parents, it's everybody. It's a perception. And I think we still have that perception in Jamaica and maybe elsewhere, that rape is somehow the fault of the woman or the man. Okay? And that is not something we're likely to end soon, except with perhaps programs like these to sensitize people to the fact that it's not a fault thing. And sometimes, even if you look at how we are asked to document, what was the person wearing.
Oh, that becomes a factor.
And how was your demeanor? Were you sad or happy or laughing? And that is something we need to document in a medical way. That is, in my opinion, a little prejudicial, but it's still something that the courts will ask about, and I think we all do it to some degree, and we make judgments, for a victim, or I shouldn't say victim, we're moving away from the word victim. If a survivor comes in, then you have this tendency to make a judgment, how you look, how you talk.
Almost like you're inviting someone.
Yes, so it's something we have to guard against, even as medical professionals. So that's something we strive very, very hard to do, is to ensure that does not come across, because especially it's the first point of entry, and that can affect whether or not a woman decides to go through with it. You say, well, if the doctor is treating me that, if the nurse treating me that way, what is going to happen to the court later on? So we know it affects that. So those are all little things that can make it one way or the other in terms of how they report it, how they see it, whether they want to talk about it. But it's a good idea, I think, to report it. Yes.
Yeah. Going back to pregnancy, when a person becomes pregnant after being raped, I know that abortion in Jamaica is illegal, but is that an exception to the law, or
according to the law, and according to my checks with my colleagues who are in the law, there are no exceptions as far as I'm aware, and that is, I think, something that we need to remember. there is nothing in the law that says you can get an abortion because you were raped. So what we do is try to prevent it from happening. So persons who come for medical attention early, right? A pregnancy test is done on them to establish that they're not pregnant, and then they're offered emergency contraception.
Okay.
Right.
So for rape survivors who are leaving the hospital, what piece of advice would you give to them before?
Well, apart from medically, from our perspective, because we know that we can end up in court, so our job really is to get the information from you, get the evidence, and give it to the police. But one of the things that we'll do is bring you back for review. So if you had injuries, we want to make sure that you've healed. Sometimes we may bring you back if the test for STDs. We will ensure that you get a referral for counseling. And everybody gets, somebody say, no, don't give it to me, I don't want it, I'm okay. But we still give it to them anyway. So just in case, hold on to it, because you might change your mind. So from that perspective, and then of course they're given their emergency contraception and any prescriptions for the any prophylaxis that we wish to give them. And then from there, they will take it up. So it's either they will go to the victim support unit, or to sometimes they choose to go to their own. They will say, no, I have a doctor, I like to go. And so you just ensure that there's some follow-up. For patients who come here in this department, I like to follow them up as well. So I will usually follow them up to a point, meaning you don't get into the investigation and so on, but you want to make sure, especially if you don't see them come back, you know, you say, okay, did you get stuff? Did you fill your prescription? Are you okay? And so, because sometimes they just don't come back, but you are concerned because they should have come back to you for whatever reason. So if you don't see them coming back, then you can give them a call. Yes.
Okay. Do you have any advice for Jamaicans about rape? Any general advice or anything?
Well, I think that in general, rape is something that perhaps, well, we know it's on the increase. And if you look at the reported cases alone, so if you multiply that by what, you have another, 75%, right? Oh. That's not being reported. And it is difficult to say, you know, do something or don't do something. But I do believe that you should be mindful of your surroundings at all times. And I don't think we can emphasize that enough. I don't believe that we should be behind cages to live a life. But we should ensure that, you know, if you're going out, it's always good in numbers. Let somebody know where you're going. Be mindful of your surroundings. The usual things that they say, you know, at night, if you're a woman, you're a target. And sometimes rape has nothing to do with anything except it's a crime of opportunity, right? Persons, we've had cases where the original intention wasn't to rape, it was to rob, right? They come up to you, they want money, but they don't get money, so they want something, and the something happens to be rape. So we still have, I think, some behavior that might be considered a little unwise. And while I don't think that anybody invites rape, I think in the same way perhaps you lock up your car and so on to prevent persons from going in, you might be a little cautious if you're a woman walking down, you know, at a dark street by yourself. Okay? You want to be careful of that. And I think going out, especially if you're going to drive by yourself, make sure that somebody knows where you are. Maybe you have an escort and so on. Having said that, we get a lot of cases where you have two women being raped in the same house at the same time because they went to turn the key and 3 men come up with guns and force them in the house. So, you know, you try your best, but the most you can really do is to be as careful as you can. Let people know where you are. Be mindful of accepting drinks from others. And essentially, if it were to happen, one of the things we say, if you're faced with that situation, long ago people say, well, you need to fight back. And we say, look, if you're faced with rape, survive it. You know, because you may want to, people say, boy, that must never happen to me, and so, and we all have our own personal feelings. We say, look, just survive it, you know. I have one of my colleagues say, okay, she can live with the sex, but she can't live with anything else. So we say it's better you're alive than you are dead. So survive it, and be careful and report it if it happens.